welcome everybody to this month's community forum for the Academy for Addiction and Mental Health Nutrition. We're going to start, as we always do, with introductions, and then I will spend some time talking about the nutritional underpinnings of postpartum depression. And just to remind everybody, this is recorded and will be put up on YouTube and various things. If there is anything personal that you want to talk about, let me know and I will turn off the recording. All right, Katina, why don't you start? Unmute. Just a very, very quick introduction, who you are, where you live, and what you do.
Hi, everyone. My name is Katina B. I have graduated from level 1. I have been health coaching for about 4 years now, and now my concentration is on nutrition for mental health. I live in Kansas, rural Kansas, yeah, that's what I do. I help people to eat better so they can feel better.
Thank you, Katina, and welcome. Mary. Do we have Mary? Okay. Sherry Baker.
Good morning. Delighted to be here. I am Sherry. I live in Maryland, originally from New York. I'm a licensed counselor, health coach. My passion and specialty is food and mood, and also inner child healing. Thanks.
Wonderful. Glad to have you with us. Yajera.
Hi, good morning, everyone. My name is Jahaida Escobedo. I'm located in Brownsville, Texas. I'm a clinical social worker, and my focus is on PTSD, depression, and anxiety, and I'm right now currently still in the training for the first part.
Level 1.
Level
Glad
1.
to have you with us. That's right. Kathy.
Yes, hi, I'm Kathy. I live in Florida right now, and I did the Biohacking Addiction and Mental Wellness Summit in June of 2022, and currently in Christina's level 1.
Welcome, Kathy. And Mary.
Hello, I'm Mary Travestino. I'm a functional nutritionist here in New Jersey, 18 years in weight loss, studied addictions, and yeah, love working with clients, helping them with gut health and cravings.
Welcome.
Thank you.
All right, thank you all. So today's topic is postpartum depression, and what are some of the nutritional underpinnings of postpartum depression? Because it is very, very common, and the medical profession has really ignored it for a long time and doesn't have very good treatment for it. And of course, we have levels of postpartum depression, right? We have, just people have a hard time, maybe the first 6 months, adjusting, they're sleep deprived, it's a big change, and, there can be depression. And you're not quite sure if the depression is biochemical or if it's just due to sleep deprivation and all the changes. But then we have postpartum depression all the way to where it gets really sad and tragic and nasty, and women can go psychotic, and women can, kill their children, kill themselves, end up hospitalized. That's the far end. So we've got a lot of room between, am I depressed or am I just sleep deprived, and full-blown bad. So just like everything, we want to know how to ask the right questions to determine what are the possible underlying drivers. And we always start with nutrition intake, right? because we know that the brain needs specific nutrients in order to function and in order to function optimally so that we can function optimally and cope with stress optimally. And having a new baby is just plain stressful, right? So our brain is designed to allow us to step up and cope with stress effectively. So when it doesn't, we always have to ask, why isn't it stepping up and doing its job? So the very first question we want to be asking is, are there sufficient nutrients in? Has there been sufficient protein for the amino acids to make the neurotransmitters and sufficient other food to bring in the necessary cofactors, the vitamins, minerals, fatty acids, etc., that the brain also depends upon for functioning? So this leads to, how was the woman both eating during her pregnancy and how was she supplementing? Well, and what are the barriers that a woman experiences in pregnancy to appropriate nutrition intake? Well, the big obvious one is what we call morning sickness, right? And morning sickness is just some nausea in the morning that gets in the way of eating breakfast, but the rest of the day is fine, and it's just the first trimester. Okay, that tends not to be an issue. But if the nausea is severe and lasts all day during the first trimester, now that is definitely going to be impacting mom's nutrient intake, and baby is going to be leaching off mom's stored nutrients. Well, if mom had been eating well prior to the pregnancy and is taking a good prenatal supplement, she might be okay. She might be okay. She might have enough stored nutrients, enough nutrients coming in from supplements that she can manage, so that when baby is born, both before baby is born and after baby is born, her neurotransmitters can still step up and function. But what if, as happens with some women, she has nausea the whole pregnancy and simply can't eat well or retain food the entire pregnancy? And what if the prenatal supplements also make her sick? Okay, now we have a setup for significant postpartum depression, for both pregnancy depression and postpartum depression. But let's remember that signs of low neurotransmitter function isn't just depression. It's also anxiety and irritability and reactivity and insomnia. Okay, lots of different symptoms. And it can also change genetic expression, so that if we have iffy genes, they can also start acting up. And I think this is partly where the more severe aspects of postpartum depression can come from. So the very first questions we want to be asking is, how are you eating? How are you supplementing? Were you keeping it down? Because that's going to determine how much supplementation the your client needs. You also want to know if your client is lactating or not, because there's a large number of nutrients that come out in breast milk. And so mom still has to be eating and retaining enough for herself and baby. And very often in the first several weeks of new baby, mom's self-care goes out the window. Unless mom has a partner who's really attentive and making sure that mom is being taken care of, she's focused on baby or sleeping or just trying to cope and isn't necessarily eating sufficiently well or supplementing. I know that for myself, the first several weeks after my baby was born, I had a very hard time remembering to take my supplements, ran out of my fatty acids, didn't even really notice that I'd run out, developed significant postpartum depression, and my nipples got so inflamed that I could no longer nurse, and I got tendinitis in my wrists. So after 6 weeks, I call my doctor and I say, I have to stop nursing because my nipples are way too inflamed. And the very first question out of her mouth was, did you stop taking your fatty acids? So I was taking both borage oil for the GLA and fish oil for the omega-3s. And I needed those actually to keep my depression at bay. Okay, both of those were antidepressant for me. And breast milk, and I was nursing, takes a large amount or contains a large amount of DHA. So I said, basically, yes, how did you know? Well, the symptoms were right there, right? I was depressed and I had significant inflammation, which are all signs of fatty acid deficiency. So the second cause of postpartum depression isn't just nutrient deficiency in general, or not enough protein in the diet, not enough amino acid support. And this, by the way, is where we use the amino acid therapy chart to identify sources of deficiency. But people in postpartum depression, very often have 10s across the board. And that just tells you that there's not enough current protein intake or not enough cofactors currently or during the pregnancy itself. So the stores have gotten very depleted. And by the way, if a woman has had several babies in a row, her nutrient stores may be getting more and more and more depleted as her pregnancies continue, especially if between pregnancies she's not eating our 5-star pro-recovery diet. But moving on to the essential fatty acids, I think the second biggest cause that I have found for postpartum depression is deficiency in the omega-3s. We know that in 1980, the World Health Organization determined that women should be, all pregnant and lactating women should be supplementing with the omega-3 fatty acids, and that preemie babies or babies who have been switched to being bottle fed rather than breastfed also need to be supplemented with DHA. Because DHA, one of the omega-3 fatty acids, coats every single neuron, and so is crucial to brain formation in utero and also while baby is nursing. So in utero baby takes up a large amount of mom's omega-3s. And so if mom is not getting enough in the diet, and we know that over the last 150 years, we have lost 80% of our omega-3 intake from our diet. So most women are not getting enough omega-3s in their diet to begin with. And then you add baby, and if they're not supplementing, baby's taking, sucking up omega-3s, mom's going to become deficient. And again, during my pregnancy, when I ran out of my fatty acids during the pregnancy, and I only let that happen twice, because both times I ended up so sick, I couldn't get out of bed. I felt like I had the flu, I was achy, I was exhausted, I was depressed. It was awful. And then once I brought them back in, I was fine. So this is crucial. Now, again, if mom's throwing up everything she's eating, she's going to get deficient in the omega-3s. If mom has had several babies in a row, all of whom have been sucking up her omega-3s, and she's not been supplementing or getting enough in her diet, as each pregnancy occurs, she's going to be more susceptible to postpartum depression. And, let's review the deficiency signs. Omega-3 deficiency signs are slow, sluggish depression, maybe brain fog, pain and inflammation of some sort, and maybe trouble with cognition, remembering, learning, thinking, that sort of thing. Okay, so this is crucial. And exhaustion, okay, because the omega-3s are involved both in dopamine production and in energy production in the body. So this is extremely important to be tracking in a woman and to making, so now we have making sure that with new baby, she's eating well, however you make that happen. She's taking a good multivitamin, stronger than just Centrum. And often a lot of the prenatals out there just are not, they're pretty low dose, so a woman may need a stronger one. And whatever fatty acids she needs. So the next thing that can happen that's nutrient focused is copper toxicity. Now, this is something that we actually need to test for. Dr. William Walsh and Dr. Mensah, who are some integrative doctors who work with mental health. And in their research with postpartum psychosis, the very severe end of postpartum depression, what they have found is that most of their patients with postpartum psychosis have copper toxicity. So we know that copper can go high when, as a result of the high estrogen in pregnancy. But if a woman also has pyroluria or low zinc for whatever reason, or maybe copper pipes or other sources of copper, maybe before they got pregnant, they had a copper IUD and they don't detoxify copper very well. So there's a number of reasons why copper may become high-level toxic in a woman. And of course, you can have several of these reasons, and then you can have a perfect storm. Well, when you have a perfect storm of copper toxicity, this is what leads women to very severe depression and psychosis and the kind of out there stuff, okay? So this is why, in general, I recommend that all of my clients, when they get their regular labs drawn at the doctor, that they request not just vitamin D, but also zinc and copper, because that balance is so crucial to mental health. And people can really go off the deep end if copper is way, way too high. And of course, pregnancy is a trigger for high copper because of high estrogen. Before we jump into some of the other reasons for it, I just want to ask if there's any questions, comments, or stories so far.
I had a comment. This is Jahida. Everything that you said, it just kind of like, I felt like that was me because I went through postpartum depression. I did have a copper IUD, the 10-year, and I was taking a prenatal, but my postpartum was really bad and they couldn't figure out how to fix me. So they just gave me a antidepressant and that kind of helped. But I had all the symptoms and I wish I knew this before.
Mm-hmm.
But my question is, if a person has a copper IUD, would it be beneficial that they would be taking zinc to counteract it? Like any release?
Yes, it would be, but the way you determine is to actually get periodically, if somebody's on a copper IUD, to periodically be getting blood drawn and checking your zinc and copper levels.
Perfect. Okay.
Now, there's a difference between the regular conventional okay range for zinc and copper, which is pretty broad, and the functional medical range for optimal zinc and copper, which is much narrower. Now, we want zinc and copper to be more or less in a 1-to-1 ratio. Dr. Walsh's recommendation for ideal copper and zinc levels are as follow. Copper needs to be between 70 and 110 of serum copper, which is narrower than the other range, and zinc needs to be between 90 and 135. And that's plasma zinc. So serum copper and plasma zinc. Copper again between 70 and 110, and zinc should be between 90 and 135. Okay, so yes, it's really, really important. And of course, if you have a client who is expressing severe postpartum depression, and the doctors don't know what to do, strongly encourage them to get a zinc and copper test. And if for whatever reason the doctor won't order it, and chances, I mean, maybe insurance will pay for it and maybe it won't, that's a toss up, but your client can always order it for themselves from dhalab.com. No, Kathy, copper should be between 70 and 110, and zinc should be between 90 and 135, according to Dr. Walsh. Okay, any other questions or comments so far? Okay. So now let's move on to hormone imbalances. Now, there's a number of different hormones that can cause postpartum depression. The first ones, of course, that we all tend to think about are your reproductive hormones. And sometimes they come into line very easily, and women start their periods again, within 3 or 4 months, and they're okay. But sometimes they're just all messed up. Typically, I think, and I could be wrong, that when the hormones are all messed up, there's also nutrient deficiency going on. So I really want to come back in with making sure that the nutrients are all in line, because that's going to help your reproductive hormone system come back in line. Now, whenever we're talking about reproductive hormones, we want to make sure that cholesterol has not dropped too low, because of course cholesterol is the cofactor for making all your, well, the not cofactor, the precursor for making all your reproductive and adrenal hormones. So there needs to be enough total cholesterol. The lower cholesterol drops below 170, the more likely people are to get severely depressed and even succeed at suicide. So keep an eye on cholesterol. Most of us don't worry about how low the cholesterol is, but those of us working in mental health nutrition need to be keeping an eye on that number. So we know that stress levels, high cortisol, can certainly throw off reproductive hormones coming back online. And so this is where, again, we start looking at all three legs of the stool, because the more stress the patient is under, the more likely they are to be depressed, and the more likely they are that all of these issues that I've talked about so far are going to be out of whack, because we know that stress depletes nutrients and cofactors, stress depletes our neurotransmitters, stress depletes, eats up the more neurotransmitter activity we have to deal with stress. We need all of those fatty acids in the right place. So the more stress there is in the woman's life, is she a single mother? Is there stress with her partner? Does she get familial support or not so much? Is there any illness? Does baby have an illness? Does she have an illness? Is there a history of depression? Is she living on food stamps? What's her context? Is the context stressful? So the more stressful the context is, well, we're going to think, well, of course you're going to be depressed if. Well, yes, absolutely. But the if, all of these different psychosocial environmental factors also significantly deplete our brain of the unnecessary neurotransmitters. Yes, Sherry.
Hi, thanks, Christina. I'm so glad you mentioned cholesterol. Because yes, I've learned from you and other places that the cholesterol shouldn't go too low. And now it's come to my attention, even through a family member, that there are cardiologists that are trying to get people's total cholesterol so low, even into the 80s. And I'm just expressing how, those doctors don't have the awareness. They even poo-poo if I try to mention this aspect. So it's just unfortunate, right?
Well, it's very unfortunate. They're not reading the research, and they're not understanding the role, the reason we have cholesterol, right? Cholesterol does a number of very crucial things in the body. It coats all of your neurons, and the axon, the myelin sheath on the axon, is made up of cholesterol.
Mm.
Bile, the way the liver detoxifies toxins and detoxifies itself, is by conjugating, tying the toxins to cholesterol,
Mm.
and then excreting it in the form of bile, which is stored in the gallbladder and then shot into the duodenum at the time of a meal, if there's enough stomach acid to signal this. And so bile is the way that toxins are excreted from the body, but bile is this cholesterol bound with toxins along with other things.
Mm.
So, and then cholesterol does other things as well. Cholesterol is the precursor for all of our adrenal hormones and our reproductive hormones. So if our cholesterol goes way too low, we're liable to have low estrogen and progesterone. We're liable to have low testosterone. We're liable to have low cortisol, right? As a cascading effect. So yes, very, very, very important. So anyway, let's get back to hormones.
Thanks for your
Sometimes
comments.
if people are not regulating themselves, that needs to be assessed. But you want to make sure other things are looked at first. And then we have thyroid. Okay. Apparently, the year postpartum is a very high risk time for a woman to develop a thyroid disorder. I'm not quite sure what that mechanism is, but apparently it's a much higher risk time for a woman to develop Hashimoto's, as well as Graves' disease, or just plain, hypothyroidism. So this also has to get assessed for. Now, most doctors do assess for thyroid function during pregnancy, but I don't know how routinely thyroid function is tested for postpartum. And especially, your TSH, your thyroid stimulating hormone, which is your standard thyroid test, with which conventional doctors do, is not sufficient to identify some of these autoimmune thyroid disorders. And so you might have to educate your client, and you might have to encourage your client to get a full thyroid panel, because the TSH by itself is not always adequate. The other inadequacy around the TSH is that the conventional range for normal thyroid is fairly large. I think typically it runs from 0.5, it can run all the way up to 6, some labs, or let's say 4.5 other labs. And that's fine for some people, but people with symptoms, if their, numbers are, near the high end of the range and they've got low thyroid symptoms, that needs to be taken seriously, even if it's still, quote, within normal. And the functional approach says that any number above 2, if your TSH is above 2 and you have symptoms, it's too high, and something needs to be done to bring it back down. So that's my brief presentation overview on postpartum depression. Any other questions, comments, stories? I'd love to hear from you all.
I just want to give a comment that I have read some articles, women that are or during pregnancy, you have a higher probability of some cancers. And when I had 2 pregnancies back to back, and so it just made so much sense that I experienced postpartum on my second child, because I was so depleted. And then about a few months later, I ended up getting thyroid cancer.
Oh.
And yeah, so it was quite interesting. My thyroid wasn't monitored as closely when I was pregnant, so it could have contributed to my postpartum depression, the thyroid issue. So just wanted to add that.
It certainly could have, especially when it turned out that you had severe thyroid issues.
Yes, yes.
Thank you for sharing that. All right. Well, if there's no other stories or questions, we can end the call. And I want to thank you all for being here. Very good questions. And I will see you all in a month.